Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. But better yet, you can call me tonight live and on the air in the Fort Wayne area by dialing 969-2720 if you're in the Fort Wayne area, or if you're calling long distance, you may dial toll free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, and I can answer the emails, and I can also answer the phone calls as well. So let's go to our first email for tonight. The first email reads, Dear Dr. Fawver, how do I manage boundaries with others? It always seems like I feel taken advantage of by family members and coworkers. It's really a difficult conversation with friends and loved ones. If you're feeling uncomfortable, that's probably where you feel like your boundary is being violated, so to speak. It doesn't mean you're a victim. It just means that you need to learn how to say no. And you might notice that other people might be taken aback if they're used to you answering them affirmatively with any requests they may have of you in the past. But it's a matter of you being more assertive. And being assertive means being able to say no if you feel like you're a little bit uncomfortable, and being honest with them if you're uncomfortable taking on the task that they're requesting. So it's a matter of identifying what you're comfortable doing. Listen to your gut. If your gut tells you you're a little bit outside your boundaries, you probably are, and that's where you need to be assertive in saying that you're not willing to take on the task they are requesting. Thanks for your email. Let's go to our first caller. Hello, Bill. Welcome to Matters of the Mind. Bill, you want to know if a transient ischemic attack, a TIA, in the cerebellum can provide recovery. Well, the cerebellum is in the back part of the brain. Back part of the brain's down here. That's the cerebellum there. Front part of the brain's up here. So the cerebellum, what if you have a TIA there? It means you have a brief decrease or loss of blood flow there that will give you no significant long-term impairment. In other words, the symptoms of a TIA will typically last for between minutes and no more than 24 hours, sometimes 48 hours. But it's a brief transient by nature, transient ischemic attack. Ischemic means loss of blood flow. So a transient ischemic attack, Bill, by definition, is temporary. However, if you have a transient ischemic attack, it means that you're at a higher risk for a stroke. So you need to get the MRI of the brain, make sure there's no damage done this time, but you also need to make sure you take care of yourself. If you have diabetes, get that in control. Get the blood glucoses in control. High blood pressure can be a factor behind a stroke. If you need to be on aspirin, 81 milligrams a day, as a means of decreasing clotting, that's something that's important. A lot of people who are at higher risk for a stroke might have sleep apnea. So if you have sleep apnea where you snore, you're pausing your breathing at nighttime, you need to get that corrected. So bottom line is, your primary care clinician or your neurologist who might be following you might want to decrease any of the risk factors that put you at a higher risk for stroke. But a TIA, by definition, it's kind of a warning sign for a stroke to come. If you have a TIA in the cerebellum, you can have difficulty with balance, coordination, slurred speech, sometimes nausea because you get dizzy and spinning sensation all around you. With a TIA in the cerebellum, you can have difficulty with tremors sometimes, and sometimes even difficulty with walking. But a TIA, by definition, resolves within 48 hours. Technically, there's no permanent damage done, but it's a big warning sign for a future stroke to come. So you need to get it addressed and get those risk factors taken care of. Thanks for your call, Bill. Let's go to the next caller. Hello, June. Welcome to Matters of the Mind. June, you want to know, how does buprenorphine work in your brain to wean someone off opiates? Basically, buprenorphine, June, is it's called a partial agonist of a mu receptor, and that's just fancy language for saying it tricks your brain into thinking that you kind of have a little bit of an opiate there, and it's a weak stimulant of the mu receptor, the opiate receptor. So by itself, it's not highly addictive. And if you take opiates on top of that, typically you won't get as much of a high because it'll actually block the opiate effect coming in. But buprenorphine is the active ingredient in medications that help people come off of opiates like Suboxone. Suboxone is something that can be used to help people come off opiates, and buprenorphine is the major component in that to help people come off of it. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I'm on Spravato nasal spray for depression, and my provider was vague about the length of the treatment plan. How long? Oh, I'm sorry. Let's go to the next email question. Here it is. Dear Dr. Fawver, I have a child who has significant anxiety about returning to school in the next few weeks. Last year, she struggled socially and academically and isn't really feeling it. Do you have any general advice for teenagers in high school this fall? Are there any benefits for being in a routine and returning to school? A lot of questions there about children, about adolescents, getting in the routine, going back to school. So let's start with the easiest part of that first. Yeah, you need to get back in the routine probably a week before going back to school, going to bed at the usual time, trying to get up at the time you need to get up for school, because you don't want to have that circadian rhythm disturbance occurring where some children are all of a sudden shocked into having to get up early and go to bed a little bit earlier. So maybe a week prior to going back to school, kind of go through a practice run. And a lot of children and young adolescents are very apprehensive about going back to school. Talk to them about it. What are they apprehensive about? Were they bullied previously? Were they having difficulty academically? Were they having trouble with change in going from one environment to another? Are they going to a new school? Let them talk about the anxiety and why they're having it, and don't discount it. Remind them that you undoubtedly had some anxiety yourself. If you're the parent, the grandparent, or even a friend, let them know that when you were that age, you had anxiety, and reassure them that you were able to endure it. But anxiety is normal when you're a child or adolescent, when you're going into a new situation. But reassure them that, okay, they get through it and they will recover, and remind them come November, December, if they're much more comfortable in school, especially, remind them that they were anxious back in August and they overcame it, and reward them for doing that. With teenagers, going back to high school, a whole different type of question. What's the best advice I can give to teenagers? I give a lot of advice to teenagers. Obviously, as you've heard me on this program many times, I've said, if you're an adolescent, if you're a teenager, do not ever use marijuana, at least until you're in your late 20s, maybe not even after that. I'm still not seeing any significant benefits on the brain with marijuana. People can always tout the benefits of pain relief and other factors, but especially with the growing brain up to 24 years of age, marijuana is extremely destructive with the brain development, and there's more and more studies demonstrating that. So, number one is stay off marijuana, but some more practical advice for a lot of adolescents will be, don't be afraid to be challenged with an opportunity, even though you feel like you're underqualified to do it. Don't be afraid of failing. Don't be afraid of looking bad or awkward in a situation. If you have a God-given opportunity given to you, my goodness, go after it. Go ahead and get involved with it, especially if you have an empathetic mentor who's involved in your challenging opportunity that's been presented. So with adolescents, I'm frequently encouraging them to not be afraid of being feeling underqualified. Go ahead and take off on an opportunity itself. And another piece of advice I give adolescents is I remind them they have growing brains. When you have a growing brain, the last part of your brain to develop is the judgment and the insight part of the brain, which is in the front. Don't do things at the age of 16, 18, 20 years of age, prior to the age of 24 years old, which is the date of the age of brain development completion. But prior to the age of 24 years of age, don't do things that you're going to later regret in your life, because you're going to make some stupid decisions. Listen to your parents, listen to your grandparents, listen to these older mentors who are trying to give you advice as you're growing up, because typically, they're on the right track. Your brain hasn't developed up to acquire that kind of insight or judgment just yet. So be aware, your brain is still growing. Don't make impulsive decisions as an adolescent or a young adult that you might regret later on. Thanks for your call. Let's go to our next caller. Hello, Rita. Welcome to Matters of the Mind. There you are. Rita, you had mentioned you were on Spravato nasal spray for depression. And Spravato nasal spray, by the way, is S-ketamine. It's the left-sided piece of ketamine. It's a nasal spray that people use twice a week for the first month and once a week the second month, and then every other week or every week thereafter. So Spravato nasal spray is used for depression. And you had mentioned that your provider was very vague about the length of the treatment plan. How long is the average treatment? You've been on this Spravato treatment plan since the spring of 2025. Really, Rita, in my experience, in my clinic, we use Spravato for patients for 6 years, starting in 2019 until 2020, late 2024. And during that time, we found that a lot of people did best if they stayed on Spravato, but yet at a less frequency. Now, it was studied over the course of 6 years. We've got a lot of data on it. It was studied every week or every other week. A few people decreased to every month in the long-term studies, but most people stayed on it every week or every other week long-term. It's indicated or approved for depression for people 18 years of age and older who have treatment-resistant depression. They've tried a couple antidepressants previously and they did not work adequately. So esketamine or Spravato is working on an entirely different chemical of the brain than the traditional antidepressants, which primarily affects serotonin, norepinephrine, and dopamine. So Spravato is primarily affecting glutamate. Glutamate, upon stimulation, will downstream in the brain enhance the natural brain fertilizer. So it's like giving your brain a shot of Miracle-Gro every time you get your Spravato treatment. So you get your Spravato treatment twice a week the first month, once a week the second month, once a week thereafter, or every other week, and that's how it was designed. But in our experience, when we use Spravato on our patients, rather than patients going off of it after 6 months or a year, and we have data now that's showing that if you go off of Spravato after just 4 months, if you go off of Spravato entirely, you're twice as likely to relapse with depression compared to if you stayed on it. So we encourage people not to go off of it entirely, but we would often bargain with people to maybe stay on it every 3 weeks, every 4 weeks. And some people would actually stay on Spravato every 1 month, every 2 months, every 3 months, and they decrease the frequency. But if you think about Spravato as being like that natural brain fertilizer, where it's enhancing the brain fertilizer itself, and in doing so, sometimes when you have treatment-resistant depression, you have difficulty with not having enough of that natural brain fertilizer. And with long-term treatment-resistant depression, they have studies on animals and now people showing that there's less branching of the individual neurons of the brain. In some areas of the brain, for instance, the hippocampus here and the yellow part of the brain here, each individual neuron should have as many as 50,000 connections. Now you have 80 billion neurons in your brain, 80 billion in your brain. And each individual neuron has between 20,000 and 50,000 connections. In the hippocampus, there should be 50,000 branches on each individual neuron, but when you get depressed, that can go down to maybe 20,000, 30,000 branches. So what we're trying to do when we treat somebody with esketamine or Spravato is to enhance the branching of these individual neurons. So again, it's like going to your backyard and fertilizing a plant that's kind of looking shriveled up. After 1, 2, 3 weeks, it starts to look better once you've fertilized it and watered it. That's what we're trying to do with Spravato, and for some people, they need less frequent watering or fertilization as time goes on. And we have found that for many people, rather than going off of it entirely, simply decreasing the frequency can be helpful. And for some people, they've been on it for several years, but they're only coming in every 2 or 3 months in some occasions. Now, if you do go off Spravato, the important factor will be to have your clinician continue to keep an eye on you. Because if you're out there at a month or two off of Spravato and all of a sudden you're getting more depressed, we want you getting back on it as soon as possible to try to revamp and try to give you that boost of fertilizer in your brain once again. So it's all a matter of talking it over with your clinician to determine if you're a good candidate to go off of it or stand on it. In our experience, when people came to us with long-term treatment-resistant depression, it was more likely they needed to be on Spravato, maybe at less frequency, but it was studied at once a week or every other week indefinitely over the course of now 6 years of data. Thanks for your call. Let's go to our next caller. Hello, Saul. Welcome to Matters of the Mind. Saul, you had asked, does your brain repair itself when sleeping? What's happening to your brain during the night? Well, during the night, Saul, you got a couple things going. You go into sleep and you've got a couple phases of sleep that are very important. You've got a non-REM sleep. The non-REM sleep is a very deep aspect of sleep. During non-REM sleep is when you're not dreaming. If you happen to awaken during non-REM sleep, you're going to sleepwalk or you're going to have night terrors. Where you're kind of confused perhaps, and you look around you for a few seconds and you don't know what you're doing. So you'll be very confused upon awakening in non-REM sleep. Non-REM sleep is very important because that's when growth hormones go sky high. Growth hormone is good for the brain and the body, so growth hormone going sky high during non-REM sleep is very restorative to the body physically itself. REM sleep is dream sleep. Dream sleep is where you'll notice that this left front part of your brain will shut down. It's the left dorsolateral prefrontal cortex. When you're in dream sleep, yeah, you are dreaming. Your brain is very active during dream sleep, and you have a natural chemical that paralyzes the rest of your body. So if you awaken during dream sleep, you might feel briefly paralyzed. It can be kind of scary, but it only happens for a couple seconds. And then you're able to get around. But there's something called sleep paralysis that occurs when people inadvertently are awakening during dream sleep, and they're still getting that paralyzing effect on their body. Dream sleep is very important for memory, concentration, attention span for the next day. So if somebody's not getting adequate dream sleep, they can have trouble with memory, concentration, and attention span for the next day. And we'll often hear about people having Alzheimer's dementia, or at least having early symptoms of Alzheimer's dementia where they're no longer dreaming. Now, very importantly, Saul, you might not remember your dreams. Your dreams are like a whiteboard where they get erased within seconds upon awakening. So if you write down your dreams or you record your dreams in your smartphone, for instance, by voice recording, exactly what they were immediately upon awakening, you can kind of remember them, and you can sort out, okay, what was that symbolic of in my life? So dreams are very abstract, and they're intended to be very abstract. You can't take them at face value. But dreams are very important for helping you with overall concentration and memory. People with Alzheimer's, as I mentioned, often will lack dream sleep. When they get treated for Alzheimer's dementia with medications like Aricept, which has been around for 30 years now. When people are on Aricept, they'll notice they start dreaming again. It kind of freaks them out. But that's normal because they haven't been dreaming for a while, and all of a sudden they're dreaming. So dreaming is good for the brain. Nightmares, no. Nightmares aren't diagnostic of post-traumatic stress, but when people have a traumatic experience from the past, they can have nightmares. Not diagnostic at all. Some people will have nightmares for various reasons. You can have more intense dreaming, and you can have more intense non-REM sleep if you're in sleep debt. In other words, you need to get 7 or 8 hours of sleep at night, but if you're only getting 3 or 4 hours of sleep because of you're studying at nighttime for school, you have work obligations, you're staying up too late for various reasons, and all of a sudden you've gone 5 or 6 nights not getting enough sleep, when you finally crash and go to sleep, you're going to get a lot of non-REM sleep and REM sleep very, very quickly because your brain's kind of making up for it. Non-REM sleep occurs within about 30 minutes of going to sleep. For some people, even faster than that. But within 30 minutes, you can go into non-REM sleep. Your first dreams are going to typically occur about an hour and a half after you go to sleep. However, if you're particularly tired, you can start dreaming a little bit earlier than that. As you go through the night, you typically will dream more and more and more. So the length of the dreams get to be longer, and from a psychodynamic standpoint, the dreams that are occurring more early in the morning are dreams that are symbolic of things you're going through in the past 48 hours. So if you can remember those dreams upon awakening, and you don't let the whiteboard get erased too quickly, if you write down what that dream was right before awakening, typically it's something you've been going through for the past 48 hours. Now, maybe you're trying to work it out symbolically in your brain. It shouldn't be something in which you act upon because dreams, as we know them in today's world, are not considered to be prophetic. In most cases, keep in mind that dreams are typically abstract and they have meaning behind them. It's just that you might forget what the dreams were. But if you write them down right upon awakening, that can help out. Thanks for your call. Let's go to our next caller. Hello, Tracy. Welcome to Matters of the Mind. Tracy, you want to know about what common ways childhood abandonment will manifest itself and how can someone find healing? Child abandonment typically is something that occurs before 8 years of age, where it's going to be highly detrimental to the brain, Tracy. There's a survey that's free. You can find it online. It's called the Adverse Childhood Experiences Scale, the ACEs. Adverse Childhood Experience Scales. It's 10 questions, and if you have over 4 of those questions answered affirmatively, it can put you at a higher risk as an adult for having anxiety and depression. So those symptoms include childhood abandonment, trauma in the childhood, emotional, physical, sexual abuse, having a parent in jail, having a parent with a drug or alcohol problem, having a parent with mental health issues. You'll see those 10 questions laid out, and if you have over 5 of those questions that occurred for you as a child, particularly before 8 years old, that can put you a little bit higher risk for having depression and anxiety as an adult. Why? Because your brain is getting hardwired during that time. If you have traumatic experiences before the age of 8 years of age, sometimes it can make it more likely that those traumatic experiences will hardwire your brain to be more prone to having anxiety and depression later on. Now, we have a genetic influence. So yes, there is a genetic influence on the likelihood of you having depression or anxiety, but you put the genetic influence on top of childhood trauma, abandonment being part of that trauma, that can put you at higher risk for depression, anxiety later on. No, we can't erase that. We can be aware of it, and we can sometimes even choose our antidepressants based on that. For instance, if you have genetic testing and you have an SLC6A4 gene, which is a serotonin transporter gene, SLC6A4, if that particular gene is has a short allele to it and another short allele to it, it's called an SS allele. If you have the SS allele combination in the SLC6A4 gene and you have early childhood traumatic experiences, that combination will make it very unlikely that you're going to do well in treatment with a serotonin reuptake inhibitor for depression or anxiety. So medications like Lexapro, Celexa, Prozac, Paxil, Zoloft might not work so well for you, especially for depression, maybe not so much for anxiety either. We need to go with a different mechanism of action for people that have the combination of the genetics and the childhood experiences that might predict they're not going to do so well with certain antidepressants. So as clinicians, it's something that we do take into account. No, you can't reverse the past, but we can help people deal with it with psychotherapy, as well as choosing which medications might fit people based on what kind of experiences they had in the past. But it's something that we take into account with the ACEs questionnaire, which is a very, very common questionnaire that people are using nowadays as a means of addressing childhood trauma. Now, here's the good news, Tracy. If you had childhood trauma, it doesn't mean automatically that you're going to have post-traumatic stress later on in life. So post-traumatic stress disorder is a phenomenon that occurs because you've had traumatic experiences, and there are treatments for that, but not everybody will have anxiety related to the past trauma. Trauma happens for a lot of people, but not everybody is impacted the same. Could be partially genetic, could be partially past experiences, past coping abilities, resilience in general, how well people are able to get over things. So there's a lot of factors in terms of who's going to get PTSD and who's not. But it's not guaranteed you're going to get PTSD if you had early childhood experiences that were traumatic. Tracy, thanks for your call. Let's go to our next caller. I'm sorry, let's go to our next email question. Our next email question reads, Dear Dr. Fawver, what happens when a medication is suddenly discontinued? Is this something I should even worry about? If a medication is suddenly discontinued, it depends on what type of medication it might be. If it's a medication in the class of the benzodiazepines, for instance, it can give you withdrawal. Withdrawal from Xanax, Klonopin, Valium, Ativan can be sometimes life-threatening, kind of like alcohol withdrawal, where it can give you tremors, shakiness. You can actually have seizures, and it can be very serious. So you want to taper off of the benzodiazepine class of medications very slowly because they can be something that can give you a lot of difficulty. If you're on opiates or narcotics, that's a whole different type of medication. You can feel really lousy for 8 to 10 days and have nausea, diarrhea, shakes, chills. But stopping opiates is not life-threatening by itself. It makes you feel extremely uncomfortable for a little over a week, but you do get over it, and typically no opiates for that matter are withdrawn very slowly. If you're on a serotonin norepinephrine reuptake inhibitor like Effexor, also known as venlafaxine, duloxetine, known as Cymbalta, desvenlafaxine, known as Pristiq, you might want to taper off those relatively slowly, especially with venlafaxine or Effexor, because it can give you zings and zaps in the hands and feet. The scalp can feel like it's burning, and you can feel really dizzy with those. So it all comes down to which medications they might be. It's not only due to the medication class, but it's also due to the duration of the medication itself. There's a medication called fluoxetine, also known as Prozac, another medication called vortioxetine, known as Trintellix. These medications stay in your system for a long time. You're not going to have withdrawal from those medications. Aripiprazole, Abilify, another medication that typically stays in the system for days, so you wouldn't have withdrawal from that. So it really comes down to which medication you're taking and what medication class that might be. Thanks for your email. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, how do I recognize triggers that might affect my mental health? Should I keep a journal to make connections between events and mental health concerns, you're a step ahead of me already because, yeah, to keep a journal. All of us should keep a journal for various reasons, because if you keep a journal, you're able to maybe put some things together in terms of stuff that's really bothering you. Some people will do this from a dietary standpoint, and they'll realize, oh my goodness, every time I have the rolls at this particular restaurant, I feel really cranky and irritable the next day. Well, maybe you have a gluten intolerance, and the rolls of that restaurant contain a lot of gluten. So there's things like that you can do from a dietary standpoint to put two and two together in terms of how you feel. But yeah, keeping a diary is a great idea. Also, keeping a diary will help you understand and recognize for the future that you can get over those particular stressors. We talked earlier about adolescents feeling anxiety about getting back to school, as well as children. Well, keeping a diary and kind of reviewing what you did at certain times and realizing that you endured it and you got over it can be very, very helpful. So what's a big tip-off that you're having trouble with mental health issues? Number one, typically will be sleep. When people start having disruptions of their sleep, that's usually an early sign you're having some difficulty. Not wanting to be around other people, not wanting to do enjoyable things, big risk factor itself. Worrying, brooding about things, always questioning. The brain circuitry changes when you start to get into having difficulty with pathological anxiety and depression. So talk it over with your clinician if you have any concerns about that. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.